Historically, two-dimensional radiographs were the only imaging modality available for endodontic or root canal therapy. Today, cone beam computed tomography allows us non-invasive visualization of the interior anatomy of the teeth and supporting structures. In this case, the dental infection can be seen perforating the sinus cavity from both the mesial buccal and the palatal roots of this upper first molar. Following the initial access through the porcelain crown and with the aid of a dental operating microscope, a fracture can be visualized on the mesial axial wall. A diamond tip ultrasonic unit is then used to trephine between the MB1 and the palatal canals in order to locate the elusive MB2 canal. A bioceramic sealer or cement is distributed to the canal system with a syringe. The root-filling material of gutta percha is then heated and condensed to conform with the internal canal anatomy.